Britain has authorized another vaccine for emergency use. One of the scientists who helped develop the Oxford-Astrazeneca vaccine calls it a vaccine for the world. It is likely to be approved in the U.S. sometime next year. Charlie D'Agata is in London this morning. How is the news being received there, Charlie?
David, it has been hailed as a vaccine that will transform the fight against COVID, a global game changer, and not a minute too soon in a country and a world under siege. Cheap, easy to store and transport, and will vastly accelerate the vaccination program. Crucially, regulators decided the first dose provides good immunity, good enough to prevent hospitalization and serious disease. A second dose follows up to 12 weeks later. Unlike other vaccines that need a 28-day booster, that extended timeline allows for the production of more vaccine, effectively doubling the number of people who can get vaccinated in the short term.
The number that'll be ready for next week is in the hundreds of thousands. And then the numbers increase significantly after that.
The urgency could not be greater. Lines of ambulances with COVID patients inside have been stacked up outside hospitals as Britain recorded its highest one-day case total since the pandemic began. Unlike the Pfizer-BioNTech vaccine currently administered here, the Oxford-Astrazeneca vaccine never needs to be kept at deep freeze temperatures, making it easier to administer in mass vaccination centers. Not just in the UK, but eventually around the globe. Now, the United States has put $1.2 billion behind this vaccine in exchange for at least 300 million doses. The question now is whether the FDA speeds up their own approval process after the decision's made here. Adriana?
Charlie D'Agata in London, thank you.